Have you ever wondered if something you take every day, something prescribed by a doctor, something you trust completely, could be quietly harming your heart? Not suddenly, not dramatically, but silently, without you realizing it, every single day. What if your heart, the engine that has carried you through decades of life, was struggling against unseen forces inside your own medicine cabinet? I know this because I have spent decades in medicine. I have watched the aging heart strain quietly under medications that are supposed to help, seen older adults follow instructions faithfully, trust their doctors implicitly, and still end up facing heart complications they never expected. I have witnessed fatigue, swelling, shortness of breath, subtle signs that too often get dismissed as just age, and I have learned that by the time these signals become undeniable, significant stress has already been placed on the heart. This information is rarely talked about, not because it's secret, but because it is complex and subtle. Medicine tends to focus on disease management, lowering blood pressure, reducing pain, controlling blood sugar, without fully considering how multiple medications interact in an older, vulnerable body. And yet, this interaction can quietly strain the heart in ways most people never imagine. Today, I will reveal exactly what is happening, why it is dangerous, and most importantly, what you can do to protect yourself and your loved ones. We will look at medications that are extremely common, widely trusted, and taken daily, yet can place unexpected stress on the aging heart. I will explain the mechanisms in simple, vivid ways, share patient stories that illustrate the silent danger, and provide practical strategies to safeguard your heart, without ever suggesting you stop medications on your own. Before we begin, I want you to take a moment. Like this video, subscribe to the channel, and leave a comment, sharing which medications or supplements you take daily. This small step is the beginning of awareness, and awareness is the first defense your heart needs. Let's start with painkillers, specifically nonsteroidal anti-inflammatory drugs, or NSAIDs. These are everywhere: ibuprofen, diclofenac, naproxen. Millions rely on them every day for arthritis, joint pain, or muscle aches. They are trusted, familiar, and convenient. But here is what is rarely discussed. Daily, long-term use can silently strain your heart. Picture your blood vessels as a system of flexible pipes. These pipes expand and contract, allowing blood to flow smoothly while absorbing pressure. NSAIDs interfere with chemicals that keep these pipes flexible. Slowly, the pipes stiffen. The heart must pump harder. Pressure rises. At the same time, the kidneys, which regulate fluid, are affected. Fluid begins to accumulate. Volume increases. More volume means more pressure. More pressure strains the heart. And all of this can happen quietly without immediate symptoms. One older adult in their early 70s relied on NSAIDs daily for arthritis pain. Fatigue came first, subtle and easy to ignore. Swelling appeared in the ankles. Shortness of breath began during walks that were once easy. They assumed it was just age. By the time they sought medical attention, the heart was already under significant strain. Regulatory agencies have long warned about cardiovascular risks with chronic NSAID use, particularly in older adults, yet these warnings often do not reach everyday conversations in clinics or pharmacies. If you take these medications, do not stop abruptly. Pain management is essential, but there are safer strategies: lower doses, topical alternatives, physical therapy, or consulting your doctor for medications that reduce cardiovascular risk. Next, let's talk about cold and flu medications, especially decongestants. Many reach for these remedies when congestion becomes unbearable. They work by narrowing blood vessels in the nose to relieve swelling. But blood vessels are not confined to your nasal passages. Everywhere in your body, vessels constrict. The heart must now pump through tighter pipes. Pressure rises. An older adult with controlled blood pressure once used a decongestant during a common cold. Within days, they experienced high blood pressure and an irregular heartbeat. They had assumed the medication was harmless. Most people do. Warnings exist, but they are small, buried in fine print, or assumed common knowledge. Older adults, particularly those with hypertension or vascular disease, are most at risk. Again, do not stop medications abruptly. Safer alternatives can include saline sprays, humidifiers, or non-stimulant remedies under your doctor's guidance. Blood pressure medications themselves, while life-saving, can be complex. Dosing that worked in your 50s may be too strong in your 70s. Blood pressure can drop too low. Blood flow to the heart and brain may be compromised. Dizziness, fatigue, and lightheadedness are often dismissed as normal aging but can signal silent heart strain. Diabetes medications also deserve attention. Controlling blood sugar is essential, yet some drugs increase fluid retention. Fluid stretches the heart chambers. Over time, this weakens contraction. Another adult in their 70s had excellent blood sugar control but gradually developed fluid overload in the heart. Medications intended to help one system can unintentionally strain another. Do not stop these medications on your own. Discuss safer alternatives or adjustments with your healthcare provider. Sedatives and sleep aids can also affect your heart. They calm the nervous system but slow electrical signaling in the heart. In older adults, this can trigger dangerous rhythm disturbances. Patients sometimes collapse not from a heart attack but from medication-induced slow heart rates. Calm can be deceptive. Never stop these medications abruptly. Gradual adjustment and careful monitoring with your doctor is essential. By now, you may notice a pattern. The heart experiences all medications together: pain relievers, cold medicines, blood pressure drugs, diabetes medications, sleep aids, influencing pressure, volume, and electrical activity simultaneously. Polypharmacy is common in older adults, and this is where risk silently accumulates. The aging heart adapts in three ways: stiffness, thickening, and electrical fragility. Stiffness reduces filling. Thickening reduces space for blood. Electrical fragility increases arrhythmia risk. Medications affecting pressure, fluid, or rhythm can accelerate these changes silently without immediate symptoms. Early heart failure whispers: fatigue, shortness of breath, swelling, difficulty sleeping flat, lightheadedness. These may seem minor, but they are messages from your heart. Medications may temporarily mask them while worsening underlying strain. Awareness, early recognition, and partnership with your doctor can reverse many of these stresses. You are not powerless. You can request a medication review, bring every pill, including over-the-counter supplements, and ask, how does this combination affect my heart? Small adjustments, guided by your doctor, can prevent years of silent strain. By now, you may be beginning to feel the weight of what I am sharing. That weight is important. It is the awareness of silent, cumulative strain on your heart, something that can build every day without you realizing it. Because the truth is that the heart does not experience medications individually, it experiences them together in a system that has aged, stiffened, and grown more fragile over decades. Let's look closer at polypharmacy, the simultaneous use of multiple medications. This is increasingly common in older adults. 5, 7, or even 12 pills a day are often prescribed, each for a different condition. Each medication alone may be appropriate. But the combination, the interactions, the cumulative effect, that is where the hidden danger lies. Consider one retiree in their early 70s who took medications for high blood pressure, arthritis, and sleep disturbances. Everything seemed under control, yet over months subtle symptoms appeared: fatigue sooner than usual, swelling in the ankles, and shortness of breath walking distances that had once been effortless. These are whispers from the heart, subtle signals of accumulating strain. By the time medical attention was sought, the heart was struggling to keep up. No single medication was to blame. It was the combination, compounded by the natural effects of aging. Fluid balance is a critical part of this story. Many medications, blood pressure drugs, diuretics, painkillers, even diabetes medications, affect how much fluid your body retains or excretes. Too much fluid stretches the heart chambers, increasing pressure and leading to congestion in the lungs or extremities. Too little fluid can cause dizziness, fainting, or kidney stress. The balance is delicate, and medications can tip it silently every day without your noticing. Electrical activity is another key factor. Think of your heart's electrical system as wiring that keeps the engine running smoothly. Sedatives, diuretics, and some blood pressure medications can alter this wiring. Younger hearts often compensate for minor disturbances. Older hearts, however, are more fragile. Arrhythmias may appear quietly, skipped beats, pauses, or subtle racing, signaling stress long before a major crisis. I have seen this repeatedly. One older adult in their mid-70s had been taking a combination of medications for years: arthritis, high blood pressure, and diabetes. Fatigue, mild dizziness, and swelling appeared gradually. They thought it was just aging. Then one morning, a sudden collapse revealed dangerously slow heart rates and fluid accumulation in the lungs. No single pill caused this. It was the cumulative effect on a heart already adapting to decades of strain. Now let's talk about warning signs, signals you should never ignore. These whispers from your heart may include fatigue appearing earlier than expected, shortness of breath during routine activity, swelling in the legs or abdomen, difficulty sleeping flat, mild dizziness, or palpitations. They are subtle, easily dismissed, but they are meaningful. I want to be clear, these symptoms are not necessarily a sign that something irreversible has occurred. They are a call to action. Awareness allows you to work with your doctor to adjust medications, monitor fluid and pressure, and protect the heart from cumulative stress. This is where empowerment begins. Even over-the-counter medications and supplements deserve careful attention. Decongestants, herbal remedies, pain relievers, all can influence blood pressure, fluid retention, and heart rhythm. The heart does not care if a chemical is natural or over-the-counter. Every substance interacts with your system, particularly when taken alongside prescription medications. Lifestyle factors also play a role in supporting your heart. Gentle physical activity, maintaining a healthy weight, balanced nutrition, and proper hydration can all reduce stress on the heart and enhance resilience. These measures, combined with careful monitoring and informed medical guidance, create a protective environment for your heart. I want to share one more patient story to illustrate the importance of awareness and early intervention. A retiree in their early 70s, taking multiple medications for blood pressure, arthritis, and diabetes, began noticing increased fatigue and mild swelling. Instead of dismissing these signs, they brought every pill to a comprehensive medication review with their doctor. Adjustments were made, doses refined, and unnecessary medications replaced with safer alternatives. Within months, energy returned, swelling resolved, and shortness of breath decreased. No dramatic interventions, no crisis, just awareness, collaboration, and careful adjustment. You see, the heart is resilient, but it requires vigilance as we age. It is not about fear or panic. It is about knowledge, attention, and informed action. The whispers of your heart can guide you to prevent serious complications before they occur. Remember, do not stop any medications abruptly. Sudden discontinuation can be far more dangerous than the slow strain we have been discussing. Instead, use awareness and informed consultation with your doctor to adjust, substitute, or refine medications safely. By this point, you may be wondering, why does the heart seem so vulnerable to medications as we age? The answer lies in the very structure of the aging heart itself. Your heart is an incredible engine. It has powered you through decades of activity, stress, and emotional highs and lows. But like any engine, wear accumulates. Its components adapt, sometimes silently, to the pressures you place upon them. The first adaptation is stiffness. Think of the heart's chambers like elastic balloons. When you were younger, these balloons stretched easily, filling and emptying effortlessly. As we age, the walls stiffen, filling becomes harder. The heart has to generate higher pressure to move the same amount of blood. Medications that raise blood pressure, increase fluid retention, or affect kidney function add to this strain silently. Then there is thickening. The heart's muscle gradually enlarges to compensate for years of working against increased pressure. Initially, this helps maintain function, like reinforcing a pump to push water through narrow pipes. Over time, thickening reduces space inside the chambers, making it harder for blood to fill and creating vulnerability to fluid overload. A single medication might not cause harm, but when combined with others, each small push can accelerate thickening unnoticed. The final adaptation is electrical fragility. Your heart relies on a precise network of electrical signals to maintain rhythm. Sedatives, certain blood pressure medications, and electrolyte-altering drugs can subtly alter this wiring. In a younger heart, minor disturbances are often corrected automatically. In an older heart, the wiring is less resilient. Skipped beats, palpitations, or pauses may seem insignificant, but they are the whispers of your heart signaling stress. Let's return to one of our key patient stories. This older adult, in their early 70s, experienced subtle fatigue and mild swelling while taking medications for blood pressure, diabetes, and arthritis. By bringing every pill to a comprehensive medication review, the doctor identified interactions affecting fluid balance and heart rhythm. Adjustments were made. Within months, energy returned, swelling decreased, and walking became easier. No dramatic interventions, just awareness and careful management. Now imagine the cumulative effect of medications over years. Each pill, each supplement, even over-the-counter remedies, contributes to the overall load on the heart. Painkillers may stiffen blood vessels, cold medications may raise pressure, blood pressure drugs may lower it too much, diabetes medications may retain fluid, sleep aids may alter electrical signaling. The result is a delicate balancing act, where even minor misalignments can tip the heart into strain. How can you recognize this silent strain? Pay attention to the whispers: fatigue, shortness of breath during normal activity, swelling in ankles or legs, mild dizziness, palpitations, difficulty sleeping flat. These symptoms may appear gradually, day by day, without dramatic warning, but they are meaningful. They tell you that your heart is adjusting to multiple pressures and may need support. Protecting your heart in this context requires three critical strategies. First, awareness. Know every medication you take, prescription and over-the-counter alike. Second, collaboration with your doctor. Bring your list of medications, discuss potential interactions, and ask specific questions. How does this affect my heart today, at my age? Third, lifestyle support. Gentle physical activity, balanced nutrition, hydration, and sleep patterns reduce stress on the heart and help medications work more safely. Let's discuss fluid balance further because it is central to heart protection. Think of your heart like a pump pushing water through a network of pipes. Too much fluid increases pressure in the pipes, forcing the pump to work harder. Too little fluid causes irregular flow and may strain the pump differently. Medications affect this balance every day. Diuretics, blood pressure medications, NSAIDs, and even diabetes drugs can all tip the balance. Monitoring swelling, weight changes, and daily symptoms gives your doctor the information needed to keep the heart operating efficiently. Electrical stability is equally important. Medications may subtly slow or accelerate heart rhythm. Sedatives, antiarrhythmic drugs, and electrolyte-altering medications all contribute. Skipped beats or subtle palpitations may feel minor, but in an older heart, they are signals demanding attention. Do not stop medications abruptly. Sudden changes can trigger more serious rhythm disturbances. Instead, work with your doctor to adjust doses safely and monitor rhythm with tools like pulse checks or heart monitors if recommended. One more patient story illustrates the power of awareness and early action. This retiree, taking multiple medications, noticed fatigue, mild swelling, and occasional palpitations. Rather than ignoring these whispers, they brought every pill to a doctor's review. Adjustments were made to reduce fluid retention and support heart rhythm. Within weeks, symptoms improved. Energy returned. Walking became easier. The heart was supported, not overwhelmed, all without dramatic interventions or panic. You can apply these lessons yourself. Track daily symptoms, maintain a clear list of every medication and supplement, and have honest discussions with your doctor. These small but consistent actions create a protective barrier for your heart. Finally, let's consider over-the-counter and herbal remedies. Many are assumed harmless, yet even these can influence pressure, fluid, and rhythm. The heart does not differentiate between prescription and non-prescription substances. Every chemical interacts with the system. Awareness, careful monitoring, and consultation with your doctor ensure that these remedies do not contribute to silent strain. As we continue to explore the aging heart and medication interactions, remember, knowledge is your first line of defense. Awareness prevents silent accumulation of stress, protects against fluid overload, stabilizes rhythm, and maintains energy. Empowerment comes from understanding the mechanisms, recognizing the early signs, and working proactively with your healthcare provider. Now that you understand how the aging heart works and how medications silently interact, let's return to the specific medications that are most commonly used, the ones that may strain your heart without you realizing it. This section is not about fear, it is about knowledge, awareness, and protective action. First, painkillers. Nonsteroidal anti-inflammatory drugs like ibuprofen or naproxen are taken by millions every day. They are trusted, convenient, and often essential for managing arthritis or chronic pain, but they work by reducing chemicals that keep your blood vessels flexible. Imagine a network of pipes carrying water. Over time, NSAIDs make these pipes stiffer. The pump, your heart, must work harder to maintain flow. Add fluid retention and the heart's chambers are stretched. This silent stress can accumulate for years. Think back to the retiree we discussed earlier. Fatigue, mild swelling, and shortness of breath were the first whispers. With careful adjustment under medical supervision, safer alternatives were explored, doses modified, and energy slowly returned. The heart was supported, not overwhelmed. Next are cold and flu medications, particularly decongestants. They narrow blood vessels to relieve nasal swelling. But those vessels are part of a system that spans your entire body. Constriction increases pressure everywhere, forcing the heart to pump harder. Older adults with hypertension or vascular disease are most at risk. Saline sprays, humidifiers, and non-stimulant remedies offer safer relief when guided by a doctor. Blood pressure medications themselves can be a double-edged sword. The goal is to lower high pressure, but in older adults, overcorrection can reduce perfusion to the heart and other organs. Dizziness, lightheadedness, and unusual fatigue may appear. These are not just age signs, they are whispers from your heart signaling strain. Consultation with your doctor allows for dose adjustments and safer alternatives that maintain control without excessive stress. Diabetes medications can also play a hidden role. While they keep blood sugar under control, some drugs increase fluid retention. Fluid stretches the heart's chambers, making the engine work harder. Over time, contraction weakens, Careful monitoring and consultation with your doctor are essential to protect your heart while managing blood sugar effectively. Finally, sedatives and sleep aids. These calm the nervous system, but they slow electrical signaling in the heart. For older adults, this can trigger rhythm disturbances. Skipped beats or pauses may feel minor, yet they can be significant signals of stress. Gradual adjustments under medical supervision help maintain rhythms safely. Throughout all of this, one truth stands clear. Polypharmacy, the simultaneous use of multiple medications, is where the heart experiences its greatest strain. Each pill contributes a small pressure, a subtle stretch, a quiet change in rhythm. Together, these cumulative effects can silently weaken the heart over years. But with awareness, monitoring, and informed adjustments, much of this strain is preventable. Now, let's consolidate what you have learned so far. Your heart, like any engine, can adapt to small pressures, but as you age, stiffness, thickening, and electrical fragility reduce resilience. Medications for pain, cold, blood pressure, diabetes, and sleep all influence this delicate balance. Early signs, fatigue, swelling, shortness of breath, dizziness, palpitations, are messages, not emergencies. Awareness is your first tool. Collaboration with your doctor is your second. Protective lifestyle measures are your third. Together, they create a safeguard for your heart. You may be asking, what can I do right now? Begin with awareness. Track every medication and supplement. Record symptoms daily. Schedule a comprehensive review with your doctor. Ask questions. How does this combination affect my heart? Are there safer alternatives or dose adjustments? And finally, consider lifestyle supports. Gentle exercise, proper hydration, balanced nutrition, and sleep management. Each step reinforces the heart, reduces strain, and empowers you to act before silent damage becomes serious. Before we conclude, remember the two key examples we followed. Both older adults experienced early whispers of fatigue, swelling, and shortness of breath. Both brought every pill to their doctor's attention. Both made adjustments under supervision. Both saw improvements in energy, heart function, and quality of life. No panic, no dramatic interventions, just awareness, careful consultation, and steady action. Your heart is resilient, but it deserves your attention. The whispers of fatigue, shortness of breath, swelling, or palpitations are not to be ignored. Medications do not have to be silent threats if you are informed, observant, and proactive. Share this information. Protect your loved ones by spreading awareness. Encourage older family members and friends to review every medication, track symptoms, and speak openly with their doctors. Knowledge is empowerment, and prevention is strength. Finally, take a moment to breathe and reflect. This is not meant to frighten you. It is meant to arm you with understanding so you can live fully, safely, and with confidence. Your heart has carried you this far. With vigilance, awareness, and informed guidance, it will continue to do so, silently, efficiently, and powerfully.